Alright, let's dive into something that's been making waves in the Western Cape, and honestly, it's about time we talked about it. Here's the deal: thousands of people are opting for a new HIV prevention method called Lenacapavir, and the numbers are pretty staggering. But what makes this really interesting is why people are choosing it. Personally, I think this isn't just about a new drug, it's about a shift in how we approach HIV prevention, and it's way bigger than just the Western Cape. First off, Lenacapavir is an antiretroviral drug, but it's not a vaccine. What many people don't realize is that it's a long-acting injection designed to prevent HIV, and it's proving to be highly effective. Between June and July, over 2,300 injections were administered across 22 public health facilities. Here's the kicker: nearly 90% of those people were first-time users of long-acting HIV prevention. If you take a step back and think about it, this isn't just a statistic, it's a game changer. It means we're reaching people who were either struggling with daily pills or weren't using prevention methods at all. Now, let's talk about why this matters. In my opinion, one of the biggest barriers to HIV prevention has always been adherence. Daily pills? Not everyone's cup of tea. But an injection every 6 months? That's a whole different ballgame. Nire Wenger, the MEC for Health and Wellness, pointed out that this convenience is a huge part of why Lenacapavir is taking off. And honestly, it makes sense. If you're someone who's found it hard to stick to a daily routine, this could be a lifeline. What's even more fascinating is who's using it. The rollout has seen a significant uptake among women, particularly pregnant women. During the reporting period, 162 pregnant women started Lenacapavir, and 7 switched from oral PrEP to the injectable option. This is huge because, let's be real, pregnancy is already a time when health decisions are critical. Giving women a more convenient option? That's not just smart, it's necessary. But here's where it gets really interesting. The highest uptake has been in areas like Nalangile Community Day Center and Khayelitsha Site B Community Health Center. These aren't just random locations, they're places where access to healthcare has historically been a challenge. So, what this really suggests is that Lenacapavir isn't just a medical breakthrough, it's a tool for equity. It's reaching people who need it most, and that's something we don't see often enough. Now, let's zoom out for a second. This raises a deeper question: why has it taken so long to get here? I mean, PrEP has been around since 2016, but it's clear that not everyone was using it. Was it the daily pill? The stigma? The lack of awareness? Probably a mix of all three. But Lenacapavir feels like a turning point. It's not just about the drug, it's about giving people options. And in my opinion, that's the key to ending HIV as a public health threat. One thing that immediately stands out is the focus on at-risk groups. The first phase prioritized adolescent girls, young women, and pregnant or breastfeeding women, groups that have been disproportionately affected by HIV. This isn't just a medical strategy, it's a social one. By targeting these groups, we're not just preventing infections, we're empowering communities. But here's the thing: this is just the beginning. The next consignment of Lenacapavir is expected in August, and the focus is on expanding access. Personally, I think this is where the real work begins. It's not enough to have a great drug, we need to make sure it gets to the people who need it most. And that means addressing everything from supply chain issues to community education. So, what's the takeaway here? In my opinion, Lenacapavir isn't just a new tool in the fight against HIV, it's a symbol of progress. It's proof that when we listen to what people need and give them options, we can make a real difference. But it also reminds us that there's still work to do. Every HIV infection we prevent is a life changed, and that's what this is all about. What do you think? Is Lenacapavir the game changer we've been waiting for? Or is there more to the story? Let me know in the comments, I'd love to hear your thoughts.